Hello all, I am Dr. Navina Singh, fertility specialist practicing in Mumbai. We females are born with fixed number of eggs in our ovaries called as egg reserve or ovarian reserve. As our age advances, the number of eggs in our ovary reduces. At birth, we are born with approximately 1 to 2 million of eggs, which is reduced to few thousand as our age is around 35 years. What does diminished ovarian reserve means? That means you are having lower number of eggs than what is expected at that age. And remember, this is irreversible. Second, that you might have a poor response to the ovarian stimulation protocols and thus increases the chances of cycle cancellation or treatment cancellation. But please remember, diminished ovarian reserve does not mean that you are infertile or you cannot have a successful IVF treatment.